Hi, hello, namaskar. Welcome to Diabetic Care India. On this channel, it's absolutely diabetes simplified. We'll keep diabetes and all the related stuff as simple and as elementary as possible. So, without much ado, let's get on with the topic. First, here's a simple question for you. Can you name the most important sex organ in the human body and where exactly it is located? You can take 5 seconds for this. All right, here goes the timer. 5, 4, 3, 2, 1. All right. Now, if you answered anything other than the right one, okay, so what is the right answer? We'll come to that soon. If you have answered anything other than that, I'm sorry, I'll need to disappoint you. You have the wrong answer. So the right answer is the organ situated in between your ears. That is the most important sex organ. All right. I'm sorry if I have disappointed many of you here because you would have thought of some other organ. Well, it's obvious, right? Okay. Now, why do we need to start off in this manner? Because the subject of erectile dysfunction that we are going to deal with today is a very complex phenomenon, and it is a sum total of several organ systems which work in tandem with each other and which has to work in coordination, in synchrony with each other to make it happen. So before we go into the names of these organs, one quick look at what exactly erectile dysfunction is. Most men at some points of their lives would have had instances wherein they have not been able to get an adequate erection despite being aroused, and they have not been able to maintain the erections. Studies show that as many as 50% of men above the age of 40 would have some degree of erectile dysfunction. So, what exactly is erectile dysfunction? The definition, please note it. It is the inability to attain and or maintain penile erection sufficient for satisfactory sexual performance. So, if you are unable to attain or maintain a penile erection sufficient for satisfactory sexual performance, and if this problem continues for at least 3 to 6 months or more, only then can it be called erectile dysfunction. Otherwise, an occasional lack of erection or an inability to maintain erection itself will not be termed erectile dysfunction. So please note this point. It happens quite often, doesn't it? So you're aroused visually through the smell or touch, but you are not able to achieve an erection and you are not able to maintain the erection. And then all hell breaks loose. You start thinking, oh, I'm not man enough. I'm not good enough. I used to be so good, but right now I can't do that. And these thoughts affect the future prospects of achieving and maintaining an adequate erection. All right. So we started off saying that there are complex mechanisms involved in this phenomenon. So what are these complex mechanisms? The first and foremost, as I started telling you, is the brain. So you have the neurological mechanisms. Once the neurological mechanisms in tandem with the endocrine phenomena. So you have neural phenomena, you have endocrine phenomena. These two have to work coordinately with each other. And then they stimulate what is called the nitric oxide cycle. The nitric oxide cycle is central to the achievement and to the maintenance of an adequate erection, because that is where the blood vessels come into the play. The blood vessels have an extremely important role. So please note this point. If you have any condition that could affect your blood vessels, then you could be a potential candidate for an erectile dysfunction. So what are these conditions? Yeah, very important. One of the commonest conditions that causes erectile dysfunction is smoking, tobacco use. So it need not be smoking alone, it could be any form of tobacco use which could cause erectile dysfunction. Alcohol is another very important cause of erectile dysfunction. Alcohol abuse, even the use of alcohol itself can cause erectile dysfunction. Another very important aspect of erectile dysfunction is the cardiovascular disease. It is said that if you have erectile dysfunction, you should be screened for cardiovascular disease. What exactly does it mean? If you have erectile dysfunction, you could be suffering from a cardiac problem, a heart problem, so to put it. Hence, if erectile dysfunction is a presenting complaint, then it is very important to get yourself checked for any underlying cardiovascular problem. Now, that brings us to the other common causes of erectile dysfunction. Now, there is a huge list. I won't bore you with the entire list, but still, I need to mention a few of them here. So, one I think I have already mentioned, that is the cardiovascular disease. Any disease that could affect the blood vessels, like for instance, especially the blood vessels of your penis and your sex organs, especially those related to prostate disease, or radiation, even blood pressure, high blood pressure could cause erectile dysfunction. Very important point to note. Those of you who are on treatment for hypertension, also known as high BP, should think of this fact. Another very common cause of erectile dysfunction. I, being a diabetologist, I get to see a number of people complaining of erectile dysfunction. These are diabetics for more than 3 years, 5 years, or even 10 years. So diabetes mellitus is a very important cause of erectile dysfunction. And then what is commonly called cholesterol problem. We call it dyslipidemia or hyperlipidemia. This condition, not many people are aware of this, could be one of the causes of erectile dysfunction, aka ED. So ED is in the news for all the right and the wrong reasons, right? Over here we are going to talk of, and we are talking of erectile dysfunction, that is ED, and not any other. All right. Now coming back to the common causes of erectile dysfunction. Liver diseases, quite a common cause, especially liver cirrhosis. Kidney diseases, kidney failure, that is renal failure, all these can cause erectile dysfunction. We started speaking about the most important sex organ, namely the brain. Diseases of the brain, stroke, epilepsy, multiple sclerosis, Alzheimer's disease, all these can cause erectile dysfunction. One very common cause of ED, which not many people are aware of, is what's called obstructive sleep apnea. In common parlance, it's called snoring. But all snoring need not be obstructive sleep apnea, and obstructive sleep apnea need not be seen only as snoring. All right. So chronic obstructive pulmonary disease or chronic sleep apnea, obstructive sleep apnea, all these can cause ED. And then there are a number of endocrine causes. But over here, I'll need to make one thing very clear. Thyroid disease as such, especially the common thyroid disease, the commonest thyroid disease being hypothyroidism. Hypothyroidism itself is not a very common cause of erectile dysfunction. Please note this point. Again, that brings us to yet another endocrine disease, namely diabetes, which I have already mentioned about. Then in these post-COVID years, we have been increasingly seeing a large number of psychiatric disorders, psychological and psychiatric disorders. They cause ED. And ED, even one episode of not achieving and maintaining an erection could cause psychological issues. Okay. Nourishment, that is nutritional disorders, especially zinc deficiency, is known to cause ED. Then you have a number of post-surgical, that is a number of surgical procedures after which ED could develop. For instance, brain or spinal cord surgeries. Then you have some lower abdominal surgeries which could give rise to ED after the surgery. Then, as I told you, the bladder, surgeries on the bladder, etc., can cause. Now, that brings us to one of the most important groups of the causative mechanisms of ED, that is, some medications. Did you know that some medications do cause erectile dysfunction? One of the most notorious groups amongst these are the antihypertensives. So, hypertension itself can cause erectile dysfunction, and the treatment of hypertension itself can cause erectile dysfunction. So, it is a tricky situation, isn't it? Next, depression can cause ED, and antidepressants also can cause ED. Psychosis can cause ED, antipsychotics can cause ED. All right. So, abdominal problems, they usually don't cause ED, but some medications given for gas, some common medications. One of them used to be pretty popular. It was called cimetidine. I don't think it's used any longer nowadays. But cimetidine was notorious for causing erectile dysfunction. And then some medications used for conditions such as balding of the baldness, that's of the scalp. For instance, finasteride, dutasteride, these can cause erectile dysfunction. High cholesterol level itself can cause erectile dysfunction, and the treatment, the medications given for high cholesterol can also cause erectile dysfunction. So it is a very sticky wicket we are on when it comes to erectile dysfunction. It's not easy to figure out what exactly is the underlying cause of erectile dysfunction. You might need to go through a number of investigations, but here is one red herring. People think that low testosterone levels cause ED, and supplementing testosterone will cure erectile dysfunction. Wrong. I need to make it very clear here that testosterone directly does not have a bearing on erectile dysfunction. In other words, if you have erectile dysfunction, then it would not be a good idea to start popping in testosterone pills or going for the patch. Testosterone patches are available. Not a good idea. So, how do you manage this? How do we figure out what exactly is going on? And how do we manage it? Yeah, that's the $1,000,000 question, right? Yeah. So we need to get to the bottom of the problem. In a number of cases, we figure out that there is indeed a psychogenic component for the erectile dysfunction. It is not just a physical problem, it is psychological, wherein both partners have an equal stake. It's not just the male partner alone. Very often, we'll need to deal with both the male as well as the female partner, or whoever. Both the partners will need to be dealt with equally. It could be the problem with both of them. Point number one. Point number two, the tests could include a hormonal profiling and all the other relevant investigations for the conditions that I talked to you about the liver function, about the kidney function, cholesterol levels, the blood glucose levels, etc., etc. We'll need. At times, all these reports could be absolutely normal. Still, the person has erectile dysfunction. Then we have our task a bit more problematic in order to figure out what is going on. Still, there are investigations, number of them. I'm not going to take you through each one of them. So they are done in specialized centers. I would like to remind you that you cannot simply walk into any lab and get these tests done. They are not done routinely at each and every laboratory. So please go to a specialized center in case you require these tests for erectile dysfunction. I'd like to make it very clear here. All right. So that brings us to the treatment. The treatment, I'm sure it's quite obvious to each one of you. Right from the time when the blockbuster drug Viagra hit the markets, even kids know what exactly Viagra is and what it does. But not many know how it works. How exactly it works is a long story. I'll not bore you with a long story. To cut a long story short, here it is. It helps in the production of nitric oxide. All right, the nitric oxide which we started off saying, which helps in the arteries, the blood vessels working optimally. And that is what helps achieve the erection. But mind you, Viagra and its friends. So there is a category of these medications. So Viagra is sildenafil citrate. Then you have the next generation, namely the tadalafil and the vardenafil. There are a number of them. All of them end with FIL. Quite popular, easily available, right? And people keep popping them without realizing that at times they could be dangerous. So what are the dangers and what are the pitfalls? How do they work? Does it mean that you just pop in a tablet of one of these pills and you get an erection? No, it doesn't work out that way. Despite having the tablet, you will need to wait for some sort of stimulation. It could be visual stimulation, it could be tactile, tactile is touch, or it could be olfactory stimulation. Olfactory is smell. So you would need to have some degree of stimulation in terms of the sights that you behold, or the smells that you get, or the touch of the loved one. And only in the right environment it works optimally, and it takes around an hour to two to work well, to start working well. So what are the problems associated with these fills? Yeah, it's not that they are absolutely safe. They do have some issues. One of them being, because they work on the blood vessels, they could cause a drop in the blood pressure in some individuals, especially those of you who are on medications for high blood pressure, especially the vasodilators. There is this group of medications known as vasodilators which enlarge the blood vessels. In those of you who are on these medications, please beware that these fills could further decrease your blood pressure. So that's problem number one. And those of you who are on this category of drugs known as sorbitrates, nitrates, so the most common one being sorbitrates, it could be even potentially dangerous. You could have a dangerously low blood pressure, and this dangerously low blood pressure could harm the blood vessels to your heart. The blood supply to your heart could decrease, which in turn can be potentially fatal. So these pills are not to be taken by each and everyone, especially those of you who are on nitrates. Please beware. And we see that these pills don't work optimally each and every time. There are instances when these pills don't work as intended or as you might expect, in which case there's no point in increasing the dose. So there are people who take 2 or 3 or even 4 tablets of 20 milligram or 10 milligram of tadalafil and then come back to me and tell me, oh, I took 4 tablets but it didn't work. Now that could be extremely dangerous, not at all a good idea. All right. So other than these fields, do we have treatments for erectile dysfunction? Yes, we do have. There are a number of treatments available, but I need to warn you again, these treatments should be undertaken only strictly under medical supervision. They are not to be done on your own. They are not do-it-yourself kits. So please beware. There are injectable forms of certain medications which are to be injected into the penis. And then there are other modalities. There are other techniques also available, but all of them need to be done after proper training or under medical supervision. So please keep this in mind. I just wanted to tell you about the commonest problems associated with ED. It's a huge subject. It is an extremely vast topic to be dealt with in a few minutes. So in case you have any comments, you have any questions, queries, please come back to us. We would appreciate your comments, your thoughts on this. Yeah, I know, yes, I might have missed out certain topics because I speak offhand. I prefer doing that so that we have, that rapport with each other. I prefer it that way rather than reading out from a prepared script. So I might have missed out certain things. Please forgive us for the lapse. It was indeliberate. But then you can remind us of what we have missed out and we'll get back to you. Thanks a lot for watching. And most important, I'm sure you have liked this topic because you have watched us for the last 15 to 20 minutes. So please show the world that you like us by liking button and by pressing the notification icon so that you get notified on time about the new videos that we post regularly. Thank you. Thanks a lot and have a great time. Bye-bye.